I'm Catherine from Arcadia Physiotherapy, and I want to give a short overview of how physiotherapy can help pelvic floor problems such as incontinence, prolapse, pelvic pain, interstitial cystitis and so on. So this is just a really quick summary. There's loads, it's a huge area, but just to give you an idea of how perhaps you as a health professional can collaborate with physios in your area to get your patient back to full fitness. So the first thing to remember is that the pelvic floor is a group of muscles. So here's a pelvis, and you can see that as I tip it here, it's a sort of bowl of different overlapping muscles that form the base of the pelvis. And again here you can see how that incorporates the different sphincters and so on. So there are lots of layers, and they have complex behaviours that are influenced by our brain system and our nervous system. But ultimately they, as a basic, do behave like muscles. So they can contract, they can relax, they can stretch, but they can also get injured, they can also generate pain and be traumatized depending on what life has thrown at us. So bladder dysfunction, be that incontinence or urgency or pain, can be related to the muscles and the way they support the organs. Incontinence can also be affected psychosomatically, which is a very real thing. So we often treat the brain as well as the physical aspect, because things like urgency can create anxiety in the mind, and that's something that physios can help with training. So here's an example of how urgency can work both mechanically and cerebrally together. So if we're thinking about the brain-bladder connection, someone might have a leak of urine in a social situation and think, well, I need to stop that happening again. So in the similar situation, they might think, well, I leaked last time. So that's going to make them feel generally a little bit anxious about that social situation or about doing the things they used to do. So one of the strategies that's really common is to say, well, I'll just go as often as I can, just in case. So before you leave the house at any point, before or after events, just as quickly as you can, and you start to live life around the toilet. What this can actually do is to reduce the bladder capacity over time. So it actually increases the sensitivity of the bladder to low volumes. It basically makes you feel fuller than you are or more urgent to go, even though there might only be 100 mils in your bladder, whereas normal capacity might be 300 to 400 mils before you start to feel full. This, of course, then leads to increased anxiety in social situations or just generally living your life. And physically, you might feel more urgent than you ever did. And that's because the brain and the bladder have a complex neurological connection. And the more anxious you might feel about a certain situation, actually the more that the bladder will respond to that anxiety and feel that sensitivity and create more urgency. And this goes round in a cycle. So physiotherapy can help with breaking this cycle by recognising the triggers, by helping the patient to measure their flow through a bladder diary or similar, and helping take control of those issues. So it's kind of coaching and it's kind of physio, but it really takes the whole person into account and the situations that make them anxious and the situations they want to work towards their goals and activities of daily living. This is an example of a bladder diary that we might use, just charting the time of day that people urinate or how urgent they feel and whether they leaked and what they were doing at the time of that leak. You can also do similar for fecal incontinence or just to monitor stools, for example, if constipation is a problem as well. And we can incorporate that as well as the sort of physical therapy that we do. Pelvic organ prolapse is a big concern for women, especially as we get older in our years. But it's not inevitable. There are many aspects and many factors that contribute to that, and it's not just about ligamentous damage and it's going to be there forever. There are loads of things that we can do to help with that. So first of all, it's education and getting people to notice what their symptoms are first, because prolapses do come and go. It depends on activity, it might even depend on time of the month for various reasons. So we can get people to become more aware of their prolapse and really identify what the key triggers are and what the key issues are and how to manage those things better. There are other things that affect prolapse, not just within the pelvis, but from the whole body. So our breathing mechanisms, our diaphragm function, the way we move, the way our core stability is. So some people, for example, hold their breath all the time for core stability, but then that will impact on putting downward pressure on the pelvic floor. So again, we'll identify the individual symptoms for that person and their individual strategies and retrain them if we need to, or just educate them so they're more aware of when they're loading up their pelvis more than they should and how to readdress that. Kegels are something that is kind of a well-known word and basically means a pelvic floor squeeze or a lift, and that is the go-to exercise for strengthening our pelvic floor and ideally supporting the organs within the pelvis. Unfortunately, it's not as easy as that, or it's not as straightforward. Sometimes in a lot of patients, actually their pelvis, the pelvic muscles are often already too strong in a way, or too tight. They're kind of hypertonic, they're not letting go, they're not able to relax and then give a good contraction. So I've seen lots of patients, for example, who thought they've been very weak because they haven't been able to contract, but actually when your muscles are 90% already, then there is no contraction to give. You know, they've got to relax to then be able to contract. So there's an element of release work. We do a lot of manual therapy as women's health physios, and that is internal release as well as external around the pelvic area. And we often encourage our patients to do it themselves at home. Firstly, you know, to physically release and continue that therapy going, but also sometimes to familiarise themselves with their own anatomy so they can then monitor further in the future what's normal for them, what might be gone wrong over time, and keeping in touch with their own bodies. However, some people are weak, and that's something we deal with as well, obviously, and we would teach them how to correctly do a Kegel exercise or a contraction. And a recent study showed that nearly 50% of ladies who took part in the study actually thought they were squeezing, but were actually squeezing the wrong bits or not doing it correctly. And actually a proportion of them were also, instead of squeezing up, they were actually bearing down, which exacerbated their issues. So we would assess that internally, we would coach them through how to lift the right things and how to synchronise that with the breathing, because that often helps with coordinating it correctly and helps with the whole body approach as opposed to just isolating the muscles themselves. So for patients with high tone pelvic floor muscles or with pelvic pain, it might be that, as I said earlier, the pelvic muscles can generate pain because of their tension, just as we might feel a bit sore and stiff in our shoulders simply because of muscular tension. So we would encourage them to either self-massage or to use tools such as the Stero wand here, which looks a bit scarier than it is, just using about half of that to simply do an internal massage. And there's we'd obviously teach them technique and make sure they were comfortable using that. Other tools we can use are things like dilators. This is for people perhaps who've had post-operative tension in their pelvic floor or scar tissue, and they just feel that they can't open up that area at all. So these, like a Russian doll, you have a sort of small one to begin with, and then gradually, as the patient feels comfortable, increase the size, using lubrication obviously to help them insert them gradually, and just to gain more comfort of having a little bit more space down there and help stretch those muscles after trauma or after operations or stitches, for example. And then finally, we can educate about pessaries. So pessaries are basically space-occupying objects that are specifically for continence and in some cases prolapse, to help support the vaginal walls into their normal alignment rather than being sort of compressed inwards by organs falling in, or help support the bladder when it needs to urinate and so on. So an example of that can be the contiform, for example, and this can be pushed up inside the vagina. So the back seat here, I think it looks like a toilet seat, the back wall here supports the posterior wall, and then this area here just sits up behind the bladder and supports the bladder forward as well. They come in different sizes, and that would need to be measured either by a physio or by a GP. There's loads of different ones on the market, so again we can have that discussion with the patient and find out what works for them and their individual situation. So that's a really brief run through of what physiotherapy can do and help with. There's physios around the UK. Although you might not have heard of us in your region, please do Google us, look for your local women's health physiotherapist, because all these things we can really make a difference with, and actually in not that long a time. Thanks very much for watching.